So, when talking about your diet, you need to have adequate nutrition because it's really good for your body to heal. You should be eating foods high in fiber, which include bran, broccoli, cauliflower, and fruits, to help your bowel movements become regular. You need to eat foods rich in calcium, and this includes dark green leafy vegetables, milk, and yogurt, and all the different types of dairy products. And then on top of all of that, you need to drink plenty of water and non-sugar supplemented juices each day to satisfy your thirst and maintain your hydration. And you need to avoid soft drinks, coffee, tea, and alcoholic beverages. Now, regarding your activity levels, you need to gradually increase your daily activities until you're back to your normal routine. You need to rest frequently. No lifting, pushing, pulling for the first 2 to 6 weeks as instructed by your physician, and please do not drive until you're released to do so by your physician. And then regarding your breast care, so your breasts and nipples may have changed or grown in size during your pregnancy. So it'll be important to wear a well-fitted supportive bra each day and night to support or to adjust to these changes. You need to wear breast pads until your breasts stop leaking, and you need to apply ice packs between feedings because this may help to ease discomfort on your breasts. And then if you're choosing not to breastfeed, wearing the well-fitted supportive bra for at least 3 to 4 days following delivery is pretty important. You need to refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate engorgement because this may end up making things worse. You need to apply cold compresses in the form of a frozen wet towel every hour as needed. And to prevent tissue injury, do not apply cold directly to the bare skin. And do not massage or apply heat to the breasts. Oh, I know. Just 1 minute. um, and then some tips on breastfeeding. If you are choosing to breastfeed, your baby's mouth should form a tight seal over your nipple. So the lip should be against the areola, not the nipple. The lip should be against the areola, not the nipple. So the dark area surrounding the nipple. And if your baby's not sucking correctly, you need to slide a finger between their lips and your breast to break the suction gently. And then after that, you need to reposition and just try again. And how long should you nurse? You should nurse as long as your baby wants, which usually ends up being around 10 to 30 minutes. At first, your newborn will probably want to nurse as many times as they can in a 24-hour period, though not for very long. And it's important for the health of your breasts to have your infant feed from both breasts every feeding. So not just one each feeding, both breasts every feeding. And then, I know. So good signs of nursing include hearing your baby swallow without a clicking sound, seeing movement above the baby's ears, and the ears may even wiggle, and not seeing dimples in your baby's cheeks. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. No pain. If you do feel pain, it may mean that the baby is not positioned properly or that the tongue does not extend past the lower jaw, and you just need to remove the baby and begin again in this case. Now for hygiene, Willow, you need to wash your hands frequently as you're caring for yourself, because washing your hands is very important to prevent infection, okay? I know. And when you're going to the restroom, always wipe front to back after using the toilet and clean your bottom with warm tap water using the Perry bottle after you urinate or have a bowel movement. And it's important that you change your pad frequently to avoid this infection as well. And then with your bleeding, so your vaginal flow, it might increase in an amount from bright, or it will increase in an amount from bright red to pinkish brown or to a yellow or cream color. And your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Then regarding your bowel movements, you need to avoid constipation. So to do this, you may take a mild laxative, a stool softener, until the bowel movements have returned to your normal pattern. And then another way that you can help to avoid constipation is by increasing fluid and fiber in your diet. And we already talked about the fiber and the hydration. Now, with birth control, this is something that you're going to need to discuss with your healthcare provider. You may choose to obtain a method of birth control before resuming sexual intercourse, and that is totally fine. Regarding the sexual activity, nothing should go into the vagina the first 6 weeks after discharge. Okay. You gotta chill. You gotta finish teaching you. Oh my god. Hello. Hello, baby girl. You gotta chill. You gotta chill. Okay, chill. Chill. Okay. Okay, 1 minute. So, sexual intercourse needs to be avoided until bleeding has stopped and you feel physically and emotionally ready. And this is completely up to you and how you feel. And then just some warning signs that if they occur, you need to report to your healthcare provider immediately. These are going to include pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision of your C-section, or if the C-section or if the incision begins to open. If the discharge from your vagina is like of a bad color or bad odor, if you have a severe headache or blurred vision, visual changes in general, a temperature over 100.4 Fahrenheit, or if you feel cold or feverish and have chills. Stop it. 1 minute. 1 minute, Willow. 1 minute. 1 minute. You need to contact your healthcare provider if you have any thoughts of harming yourself or your baby. If you have any pain or burning sensations, redness, warmth, or swelling in your legs. If you have breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or red streaks and flu-like symptoms. If you have sharp pains in your abdomen, breasts, or chest. If you have trouble breathing, dizziness, or faintness. And if you have crying spells or mood swings that feel out of control. If you have difficulty emptying your bladder, or difficult, painful, or too frequent urination. If you have difficulty having a bowel movement. And if you need to report domestic violence or abuse, you need to call 1-800-96-ABUSE. Now, moving on to the infant. So some safety precautions when talking about your infant. With sleeping, you need to place your infant on his or her back to sleep. You need to use sleep clothing such as a one-piece sleeper instead of a blanket. And do not let anyone smoke around your infant. This is very important. It's important to use a firm mattress and a safety-approved crib covered by a fitted sheet. And car seats and other sitting devices are not recommended for routine sleep. If you're in the car, you know it's okay, but not for routine sleeping. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should not sleep in the same area or the same room as the parents. The baby should sleep in the same room as the parents, but not in the same bed. And the reason for this is because smothering happens more than we like. And it's also important to avoid covering the infant's head or overheating during sleeping. Now with the bulb syringe, you need to keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. You need to clean the bulb syringe well with warm soapy water after each use and allow it to air dry. And then you do need to make sure that you wash your hands prior to handling the neonate in any situation. Regarding the car seats, all infants are required by law to be in a car seat while the car is in motion, and children should be placed in a child safety seat according to state laws. And then at home, the use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. You need to question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. Now, with your baby's behavior, crying is a normal response for your infant. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. And you should make sure to burp your baby after each feed. And then some calming techniques that you can use include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. And it's never okay to shake your infant. It's never okay to shake your infant. And if you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. Now with your infant's sleep patterns, infants do require a lot of sleep. You should be waking your baby at least every 3 to 4 hours for feeding. And you should place your baby on his or her tummy each day for supervised tummy time. This will strengthen his or her neck and abdomen. And then with the diet, now if your baby is breastfeeding, your infant should breastfeed 8 to 10 times per day per the infant cues. And for positioning, you need to be sure to hold your infant close to you while feeding. Your infant needs to be cuddled and skin-to-skin time is recommended. After feeding, you need to hold your infant upright over your shoulders while gently patting or rubbing his back to burp. So like this. And then if you are choosing not to breastfeed but to formula feed, your neonate is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feeding, awaken your baby to feed. Willow, stop. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life, and then they will need to eat every 3 to 4 hours thereafter. Now with positioning for formula feeding, be sure to hold your infant close to you while feeding. Your infant needs to be cuddled, and never prop your infant's bottle to feed. And then when burping your baby, infants need to be burped every ½ ounce of formula. So every ½ ounce of formula you give, you need to burp your baby. Okay. So basically to do this, after feeding, you hold your infant upright over your shoulder while gently patting or rubbing the back to burp. Now, here are some newborn characteristics that your newborn may exhibit. So it's normal for your infant to develop a rash on their skin. It appears with small red circular areas with a white dot in the middle, and this does not require treatment and will generally resolve within the first week of life. This is actually called erythema toxicum, that's the long name for it, but it's just a red rash, and you need to avoid lotions, powders, and perfumed soaps with this condition. Now with milia are pearly white bumps, usually on the face, especially on the nose, and they will disappear within the first week of life. And then jaundice. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to his or her skin. It will start in the face and progress down to the toes. If your infant appears more yellow, or jaundice, in the next 24 hours, you need to call your healthcare provider immediately. Now just some care for your infant. With bathing, your infant will need to be sponge bathed. Oh, I know. Oh, baby. Oh, okay. Okay, just calm down. Chill out, okay? Chill out, okay? Stop. Please stop. Okay. So your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, you need to gently wash your infant's face, and you need to bathe your infant from head to toe, saving the diaper area for last. And you need to be using a mild infant type soap for your infant's body. And then for their cord care, you need to keep the umbilical cord clean and dry. Cleanse it with warm water and soap when it's soiled, and inspect the cord and the surrounding skin with diaper changes and notify the pediatrician if drainage or discoloration is noted. The cord will generally fall off within 2 weeks of life. Now, for wet and dirty diapers, 1 to 2 wet diapers are normal for the first day or two of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. Over the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least one bowel movement every 24 hours. And you may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. Okay? Then, if you have a little girl, if you have a little baby girl, you need to make sure to always wipe the baby from front to back. You need to be sure to cleanse all areas, all creases and folds to prevent that diaper rash. And then pat and dry and then put on a diaper. It's normal for baby girls to have a white or pinkish discharge. The secretions are normal and will gradually disappear. And then if you have a male infant who is uncircumcised, always wipe the baby from front to back. Be sure to cleanse all the creases and folds to prevent the diaper rash, and pat and dry and diaper. And then if you have a male who is circumcised, you need to always wipe the baby from front to back as well. Be sure to cleanse all the creases and folds to prevent the diaper rash as well. Pat, dry, and diaper. And then additionally, Vaseline gauze is applied to the circumcision with every diaper change for approximately 24 hours. The head of the penis will appear red initially, and then it will change to have a yellowish, sticky film. This is very normal. But if you see any bright red bleeding or green drainage, you should contact your healthcare provider immediately. The plastic ring method of circumcision does not require dressing. The ring that is used will come off usually by 2 weeks. If you notice swelling, bright red bleeding, or green drainage, you should contact your healthcare provider. To cleanse the area, wipe gently with a soft cloth, cotton swab, or gauze pad in plain water. And then last little bit, for the dressing, you need to dress your infant as you would yourself. So avoid overdressing them, avoid underdressing them. Too much clothing and too many blankets may cause your baby to become overheated. And then last thing, your baby should receive all of the recommended vaccines.